Hey everybody, Dr. Schmid here. I'm going to talk to you about another one of my cases. This is an implant case. Implant cases can be a little tricky in the aesthetic zone. I'm not a huge fan of implants in the aesthetic zone just because they're not as predictable when it comes to how they turn out in terms of color matching, size, shape, position. Mainly because the implant has to be put where the bone is, and sometimes that's not consistent with the best aesthetic outcome. This is a young man who came to me wanting to improve his smile. Obviously, he has some asymmetry with his two front teeth. And you notice something weird going on with these laterals. Those are implants. You can see that they're kind of a different color and they're opaque. Implants are tough to match to natural dentition because of what's underneath the implant. When you think about implants, there's the fixture that's in the bone, and then we have to screw something on top of that called an abutment. And those abutments are typically either titanium or zirconium. And light doesn't go through those like they do natural teeth, which makes it very difficult to make an implant crown look like a natural tooth. But we decided we'd tackle it anyway. You can see the dark shadowing up here, or the darkness, where his gums are kind of gray. That's the metal that we're seeing underneath there. And then also you can see how they just don't match the rest of his teeth. So the plan was, let's close that gap. Let's make his two front teeth as symmetrical as we can. And let's make these laterals look as natural as we can. One of the tough things about implants, like I mentioned before, is they've got to put the implant where the bone is. This tooth, the position of the implant is so labioverted, which means it's out towards the lip, that the access to screw everything onto the implant is actually right here. The hole is right there. Normally the hole's on the back side, which is makes things easier because now I can just take the abutment and the crown all together and just screw it in if I want. But in this case, I have to put the abutment on, screw that down, and then I have to cement the crown on top, which means now I have to use a titanium abutment because things are a lot thinner, and then use a cement retained crown. Those things are all going to mess with my ability to make things look natural. But like I said, we gave it a shot anyway. After a lot of communication with the lab, we decided to use a titanium abutment, but to go in and opaque it out. So we used a lot of opaquer, which is a technique to try to make a piece of metal look white, basically, so that we don't have this grayness showing. So let's see what we came up with.